Top of the morning to you folks. Here we have our patient, Jenny freaking Wilder, fin number 12115011, as we all know how important the fin number is. She currently has an art line in place. Blood pressures are a little unstable. She's under a food coma. So we're going to go through and explain exactly how an art line works to you. So we're going to chat about our pressure bag here first. We need a pressure bag to help keep fluid running through the art line rather than having the blood come back up through the art line. So the pressure bag helps that. You want to always make sure at the beginning of your shift that the pressure bag, one, has fluid actually in it, so there's a 500 ml bag of NS, and two, that it is pumped up to the green or 300 millimeters of mercury here. And you pump that up by this bulb, kind of like a blood pressure cuff. Then as we follow our way down this line, you've got a roller clamp here. When in use, your roller clamp should never be closed, so you always want to check that as well. As we go a little bit further, you have your transducer right here. Come in close, come check this one out.
Want to know how I know that's a transducer? Because of the way it is.
So as we were talking about the transducer is what reads our patient's blood pressure. Directly next to our transducer, because we're still on the topic of a transducer, is our stopcock. This is how you control whether you can get blood back or whether NS will go down your line. It's also where you control how you zero your line. As we go a little bit further, this may or may not be here. You may or may not see this. If this is here, you likely have a safe set in place. What's the purpose of a safe set, you ask? Well, let me just tell you. Blood draws, that's it. That's really it. Let's now talk about zeroing our line. Every art line needs to be zeroed every shift with position changes and as needed. If you're getting crazy blood pressures and your wave looks like a flat line, probably should work on zeroing your line and testing it out. So to zero our line, we're gonna pretend that we have a monitor in our room right now. So since our room has a fully functioning monitor in it, we're going to turn our stopcock. Come in close and I'll show you this one real nice. Turn your stopcock off to the patient. Are you wondering right now which way is off to the patient? Well, if you just follow your line down, it's where it connects to the patient. Real tricky, I know. Also, if you just feel the tubing that is a little harder is the tubing that connects to your patient. The tubing that is a little more flexible is the tubing that connects to your pressure bag and NS. So now that we have it off to our patient right here, we're gonna take our cap off, but you have to have Hulk hands to get it off. We're gonna pull till we get a little bit of fluid, a little bubble at the top, and then you're gonna push 0 on that monitor that's in your room that's working perfectly well. It's gonna beep twice, then you're gonna put your cap back on. This needs to be a new cap every time, ladies and gentlemen. Turn it back to the neutral position. Pull this little pigtail right here, and your line is zeroed. That's a wrap, folks. Miss JFW here needs a blood draw. So, since we have an art line in place, we're going to draw from our art line. We're gonna need our vacutainer, an alcohol swab, a mail transfer device, and the connector piece for the mail transfer device. We'll put those together right now. I usually like to keep my transfer device in the package that it came in. I just put them together like that. Now, since JFW has a safe set in place, we will practice using the safe set to get the blood draw. When you look at the safe set, there is a little piece right here that locks it. You can hear it click when you lock and unlock it. So when we draw back our blood, we pull back slowly, going at 1 cc per second.
I need some Dilaudid and bring it with some Colace.
She's pretty distended.
That, my friends, is a food baby.
So essentially, this piece right here is acting as our waste. So we don't need to throw away 10 mils of her blood. Often these patients that have art lines are getting blood draws. A lot, so we want to waste as little as possible. Once we've filled this with the 10 or 12 mils of blood, then you turn this piece so that when you access right here, you're not pulling any of this waste blood. You're pulling everything from her artery. So we grab our transfer device, our alcohol swab, and our blood tube. We clean off the site. And you all know how long you're supposed to scrub. 30 seconds. And then you let that dry. After it's dried, you can attach this right on. And then insert however many vials you need. And they will fill however many you need. And then make sure you don't twist this, otherwise JFW is bleeding out. Make sure you just pull it right back off. Now, we have to deal with this beauty right here. Make sure you turn this stopcock so that we can give it all back. Give it back at 1 cc per second. Until you hear it click again. Then you'll also notice there's still a ton of blood in this line. So we'll go back up to our transducer, and you can kind of watch right here, pull our pigtail, and that's how we'll flush the line. You want to make sure that there is no pink left in this line. Oh, hey, come on back in. Now, we're going to practice a blood draw without a safe set. So, everything is going to start from your transducer and the stopcock next to the transducer. You need to bring all the supplies that you are needing. 2 sterile 10 ml syringes, prepackaged. Don't open them and lay them on the bed like I'm about to. Your vial for the blood. Transfer device. Make sure it's a female this time.
You know it's female because it's pink. That's pretty neat.
And a new cap. So here, we want to turn our stopcock off to the patient. Take our cap off. Luckily, we don't have to worry too much. Jenny hasn't moved in days. And then, we're going to attach one of our sterile 10 ml syringes to that connecting point right there. Then we're going to flip this all the way back, so we're turning the NS off, which allows us to pull from right here. And as you can see, we're getting blood back. This is one of the reasons we want to do a 10 ml waste. You can see most of this is NS up to this point. So when we get our blood sample, we'll be getting a true blood sample. We won't be getting any NS mixed in. At that point, you want to be sure to flip this back over so that it's off to the patient. Otherwise, you're going to get blood coming out. Dispose of this as you would any blood, biohazardous material, in a red bag. Connect your new syringe. Flip it off to the NS. Pull back however many mils that you need. Make sure you turn it back off. And you can use your transfer device now to put it in a tube. So once we've gotten our blood sample, I like to zero at this point as well. I bring a paper towel, place it up next to my line, pull my pigtail. That flushes the blood out of the line. You can zero it on the monitor at this point too, and then you'll want to grab your new cap. Place it on, put it back in the neutral position, and make sure you flush that line till it's completely clear, no pink left over. And that is doing a blood draw without a safe set, my friends. I've sensed that Jenny has been in quite a bit of food baby pain, so I brought her some Dilaudid. We'll go ahead and administer that now.
You don't give medications in an art line, and that's not a medication syringe.
Lose their blood pressure. We are very closely monitoring Jenny F. Wilder's blood pressures. Then you're gonna put your cap back on. This needs to be a new cap every time, ladies and gentlemen. Don't reuse those caps. I know you want to. Miss JFW here needs a blood draw. So, since we have an art line in place, we're going to draw from her art line. We're gonna need our vacutainer. Is that what they call these?
Yeah, we're gonna have to do a retake.
I'll edit that out.
Okay.
An alcohol swab. A mail transfer device. And the connector piece for the mail transfer device.
That, my friends, is a food baby.
So here, oh crap. Here.
I'm gonna zoom in on you. Oh, it's videoing.